So let's start talking about the disorders of the immune system, the actual diseases that could result from either hypoactivity of the immune system or immune deficiency, and of course the famous example is HIV and AIDS, or hyperactivity of your immune system, the autoimmune systemic lupus erythematosus. And we're going to start with HIV or AIDS. AIDS, acquired immune deficiency syndrome. We used to call it syndrome when we did not know the cause for it. So we noticed that some people are very weak. They are too weak to fight some weak pathogens, and they acquire different and unusual and recurrent and severe infections. So obviously these people have had something wrong with their immune system that lowered their immunity, and because we didn't know the cause, so we called it acquired immune deficiency syndrome. And the name still is continuing with us even after we have known that this syndrome is caused by the human immune deficiency virus or HIV virus. HIV virus is transmitted by sexual contact, is transmitted by blood products. These are the two major ways of transmission of HIV virus. The body fluids have the virus, but one of the body fluids that do not have the virus is the saliva. So the mere contact with an HIV patient is not infectious. It has to be a sexual contact or a contact with infected blood. So how to diagnose a patient with HIV? How to diagnose that you have the virus inside your body? You have the virus inside your body. To diagnose this, we have the famous two tests, the ELISA test. This is a fast test and relatively inexpensive, but we have to confirm the ELISA test by the Western Blot test. And this Western Blot is the confirmatory test for the presence of antibodies against HIV virus. And then, if you want to know the load, the viral load, how many viral particles of HIV you have in your body, and this PCR or polymerase chain reaction that we identify the viral load in your system is going to be helpful in the follow-up. But to begin with, to diagnose HIV virus, this is how we are going to declare a person as an HIV positive. We need to do the ELISA. If the ELISA was positive and this was confirmed by a positive Western blot test, then the person is considered HIV positive patient. If the ELISA was positive but the Western blot was negative, the person is still considered HIV negative, not having the HIV virus in his system. Let's talk more about the pathophysiology of HIV infection. Now, HIV loves to invade the CD4 cell or the T helper lymphocyte. And if you remember, I said the T helper lymphocyte is the chief cell in our immune response. It's the president, it's the king of this nation called the human body. So when that T cell, this CD4 cell, we call it CD4 cell because it carries a certain type of protein on the cell membrane called CD4 protein. So when you kill the king, the whole city will now collapse and the enemy will be capable of invading this city. So when the HIV virus infects the CD4 cell, your immune system simply collapses. And this invasion happens in a series of steps. The first step, the virus is going to approach the cell and will bind to the cell membrane and will fuse with it and will enter into the cytoplasm of the CD4 cell. And then the HIV virus is an RNA virus. And all viruses, they cannot replicate by themselves. They have to make themselves part of your own DNA so that each time your cell divides, your cell is going to make baby viruses. But this HIV virus has a problem. I'm an RNA particle. I'm not a DNA particle. But it also has an enzyme called reverse transcriptase. And this enzyme will make the viral RNA be reverse transcribed into a viral DNA. And then this viral DNA will go inside your nucleus where it integrates itself with your own DNA. And each time your cell divide, The DNA replicates, making copies of the viral DNA, and then the viral DNA is going to be used in making the viral RNA and the protein coat in the stage of transcription, translation, and assembly, and finally these baby viruses are going to exit your cell. This life cycle, although it's kind of complex, yet it provides different steps, different points where we can attack the process of HIV infection. We can attack this process at the stage of entry. We can give you some drugs like Maraviroc that will prevent the virus entering your cell. We can give you reverse transcriptase inhibitors, and this is a huge group of cells by which we can prevent the viral RNA from becoming a viral DNA, and we have a lot of medications, as we're going to see right now. I can give you a medication that prevents the integration. I can give you medications that prevent the protein assembly of the virus. So this life cycle, when we understand it, is going to enable us to appreciate and understand the different mechanisms of action of the anti-HIV medications, or what we call the antiretroviral medications. As I said, we can use entry inhibitors, we can use reverse transcriptase inhibitors, we can use integrase inhibitors, and we can use protease inhibitors. And here are some different names and examples. You're going to see a lot of names. I don't want you to be overwhelmed with these names. The most important thing about the antiretroviral or anti-HIV medications is going to be the side effects. We have to know what are the expected side effects of these medications. So this table again summarizes for us some examples of HIV medication, or what we call antiretroviral drugs. So the HIV therapy is never a monotherapy. There is no single drug that we use, but we use a combination of drugs. And to help the patient's compliance, we put this combination in a one pill, in a one tablet, in a one capsule. So we're making it easy for the patient. And we call this approach the highly active antiretroviral therapy, or HART. Now HART is the standard of care in managing HIV infections. And thanks to understanding the different steps of HIV life cycle, we are now capable of very adequately and efficiently treating HIV infections. So any HIV infection is going to be treated by 2 nucleosides and a protease inhibitor, or 2 nucleosides and Efavirenz. A minimum of 3 drug combination in one tablet or in one capsule. This is the HIV therapy. 2 nucleosides. What are the nucleosides? The reverse transcriptase inhibitors. 2 nucleosides and a protease inhibitor, or 2 nucleoside and an Efavirenz. When to start HIV therapy? When should I start it? The most important thing to protect is the CD4 cell count, because the CD4 cell count is the crucial element. When it goes down, it puts you at more risk for acquiring immune deficiency or for acquiring this vulnerability to infections. Normally, your CD4 cell count should be above 1,000. Somewhere between 900 and 1,200. Usually the agreed upon approach is whenever your CD4 count drops less than 500, we should start treating you with antiretroviral medication. So the first indication for starting HIV therapy is CD4 count less than 500. What if you developed symptoms? We developed opportunistic infections, as we're going to be talking about, and your CD4 count is above 500. This means that this count is too low for you, and this is why you're developing these opportunistic infections. Then we have to start antiretroviral therapy in any symptomatic patient, regardless of the CD4 count. Pregnancy is the absolute indication for HIV therapy. Any pregnant lady who is HIV positive should receive antiretroviral therapy regardless of her CD4 count. You might be pregnant and your CD4 count is 1000. That's perfectly normal, but still you need to take the antiretroviral therapy because now we want to protect your baby. And thanks to this regimen, we now have a very high percentage of normal HIV negative babies born to HIV positive mothers. More than 98% is our rate now, and this is a great success. And finally, and this is very important to healthcare workers in the healthcare field, needle stick scenarios. I got stuck by a needle coming from an HIV positive patient. What should I do? You need to take antiretroviral therapy for 1 month, 2 nucleosides and Efavirenz, or 2 nucleosides and a protease inhibitor. Okay, side effects of antiretroviral medications. All of them cause liver toxicity. Protease inhibitors, the ones that end with the suffix avir, protease inhibitors make you greasy and sweet. They result in hypertriglyceridemia and hyperglycemia. Antiretroviral medications can result in osteoporosis. Abacavir is one example that results in severe skin manifestations, kind of similar to Stevens-Johnson syndrome. Didanosine, stavudine, both can result in pancreatitis and peripheral neuritis. Whenever an HIV patient is receiving heart antiretroviral therapy and presents with anemia, think of zidovudine as the cause of anemia. The point why I'm emphasizing these side effects is what? When a patient comes to you receiving an antiretroviral medication and he's having one problem, you should be able to identify what is the source of this problem. So you only stop this medication or replace it with another medication, rather than stopping the whole thing. Like, you cannot say, I stopped all the 3 medications, I stopped antiretroviral medications because the patient has anemia. Why? You could have identified the cause of anemia and just replaced zidovudine with any other medication. Hyperglycemia, hyperlipidemia, as I said, caused by all proteases. How can we identify that this drug is a protease? It's going to be ending in the suffix avir. Kidney stones, indinavir, which is a protease inhibitor, again can cause hyperlipidemia and hyperglycemia. Still, it's unique in causing kidney stone. Can you believe that? Kidney stone due to a drug? Yes, indinavir. Peripheral neuropathy, didanosine, stavudine. Lamivudine is relatively safe antiretroviral medication. Another thing I want you to know about Lamivudine, it's also used in treating hepatitis B. Ritonavir. Here is a very important pharmacologic point that we need to understand about Ritonavir. What's Ritonavir? Ritonavir is a protease inhibitor, and it is in the same time an inhibitor for the hepatic enzymes that metabolize the antiretroviral medications and a lot of other medications, the cytochrome P450 hepatic system of enzymes. Ritonavir inhibits this CYP system. So when you take Ritonavir with any other drug, this other drug is not going to be metabolized as efficiently as when you take it alone without Ritonavir. So the blood levels will increase. We make use of this fact by giving the patient some Ritonavir, and this will enable us to lower the doses of the other antiretroviral medications, because now we are sure that Ritonavir is inhibiting the hepatic metabolism of these medications, and this will enable us to use Ritonavir in small amounts and use other antiretroviral medications in small doses, and this will reduce the side effects. Maraviroc. Maraviroc is an entry inhibitor. It blocks the very first stage of HIV life cycle, preventing the entry of the virus into the CD4 cell. Efavirenz is the only HIV medication that is absolutely contraindicated in pregnancy. As I said, in pregnancy, we should treat HIV at any CD4 cell count. We can use any antiretroviral medication except Efavirenz. It's contraindicated to be used in pregnancy. And the side effects of Efavirenz are very unique. It causes drowsiness and nightmares and some depression. It acts on your CNS.